Hello, everybody. Welcome to my channel. Today, we will be talking about fracture healing, basically, how the bone heals after fracture. So, there are two types: primary healing and secondary healing. Both depends upon the degree of fracture and what is the condition of the fractured segments. For example, if the fractured parts or fractured bone segments are put very close to each other in the anatomical position, and there is not much space and richly vascular supplied, then both the segments grows and he directly heals the bone, and there is no callus or any bridging tissue formation occurs in this case. But mostly, what is important and what is the actual healing type is secondary healing, right, where the bony fragments are put at some space and there is not direct healing. There will be callus formation, and the callus, which is which forms the bridging tissue and thus allows the bone to heal itself. So there are different stages of this secondary healing, which is major phenomena for this fracture healing of the bone after the fracture. So initially, what occurs in 2 to 3 days, initial 2 to 3 days of the fracture is that the tissues, so due to the fracture, the capillaries and the blood vessels gets ruptured, and there is collection or pooling of blood, which is called as the hematoma. There is aggregation of the fibroblasts. Then there is release of tissue growth factors, which leads to the conversion of the fibroblasts into the osteoblasts, right? And this occurs, which is the inflammatory reaction or the granulation tissue formation, and this occurs at around 2 to 3 weeks. This osteoblasts formed. Osteoblasts are what? Osteoblasts are the cells which leads to formation of the new bones, right? So osteoblast does what? It will grow and form the tissue around that fracture site, and that tissue will be definitely irregular and will be void of or containing less amount of minerals, right? Soft tissue and bridging tissue between the two fragmented sides. Then there will occur what? This around 2 to 3 months this happened, right? Then around about at 2 to 3 years, what happens? Let's slowly with time there occurs deposition of more and more calcium occur, okay, and that leads to consolidation. Consolidation means that solidification of that formed callus tissue or the bridging tissue, right? Then what happens is this bridging tissue is consolidated, clinical healing is occurred, right? But the collagen present there is irregular, and there is irregular healing, right? Then occurs the stage of bone remodeling, where the osteoclast will be functional and it will take its original shape, which occurs around after 2 to 3 years, right? So this is the actual process of it. Now people come to me and ask that how at what time the implants, that is plates and rods that we have put during the surgery, how much time it should be removed actually, right? So there is no idea, there is no rule that you have to get it removed, but in the cases of osteomyelitis or infection at that site, or if it causes the tissue irritation, it needs to be removed. Ideally, it should be removed after 2 years of the actual fracture healing surgery, or the surgery that happened during the fracture occurred. So that is the timing. The fracture healing depends upon age. Definitely in old age it will be delayed and will take time, or the blood supply will be reduced also. Then it also depends upon the nutrition. If the calcium amount, vitamin D, and these things are very important, so nutrition is also plays a role in the fracture healing. Then if the person consumes tobacco and alcohol, that will definitely supposed to reduce or delay the fracture healing. Right. If the fracture is of open type or the contamination is more, the fracture healing is supposed to be delayed or less. And if there is ischemia, that the blood supply is less at that site, then there is chances of non-union or delayed union, right? And if there is improper immobilization, means it is mobile, then there is also this will also affect the fracture healing. So this is the topic of fracture healing. I think I have explained it my way, what I have understood so far. So good luck, see you in the next video.